Thank you, Madam Chair, and I also join, as I know Senator Warren does and Senator Kaine does, in sending out our respect, our affection to our colleague Claire McCaskill, who will be back with us soon. Chairman Collins, thank you for holding this incredibly important hearing. As too many Hoosiers and too many Americans have come to know firsthand, opioid addiction and heroin addiction is devastating families and communities across this country. It has impacted communities large and small, urban and rural, working class and wealthy. It has touched our families, friends, and neighbors, and far too many children. In my home state of Indiana, like so many other parts of the country, we have seen there are no boundaries to this crisis. And today we're here to learn how it is impacting our nation's seniors. In Scott County, Indiana, we experienced an HIV outbreak, as Dr. Adams, one of our witnesses, knows. More than 185 people in a town of 4,200 have tested positive for HIV. And it's largely driven by injection drug users who shared needles. This crisis has gripped Scott County and Austin, Indiana. This has not only been hit hard by HIV, but also by other drug addiction as well. We learned from the CDC this was an intergenerational epidemic where youth, parents, and grandparents were all addicted to the same prescription painkiller. We must utilize and leverage every possible tool to address the opioid abuse and heroin use epidemics. That's the approach we have taken, working on legislative solutions, collaborating with federal partners, our state law enforcement, public health officials, prescribers, and community stakeholders. For more than 2 years, I've been working to combat the opioid abuse and heroin abuse epidemics in Indiana. I reintroduced a bipartisan bill with Senator Ayotte last spring that would take a multi-pronged approach to help communities devastated by this epidemic. Our bipartisan bill focuses on several key areas, including enhancing training and education for prescribers. I'm eager for the Senate to take up the Comprehensive Addiction and Recovery Act that was introduced by our fellow committee member, Senator Whitehouse. I'm proud to support this legislation and was pleased to see that the committee-passed version includes provisions to update prescribing best practices and raising awareness of this epidemic, similar to some of those areas we have worked on with Senator Ayotte. I encourage that both the Obama administration and the state of Indiana have announced their intention to adopt or act on a number of the policy recommendations that has been suggested, and that the President mentioned the drug epidemic as a place for bipartisan cooperation in the coming year. And our chairwoman has helped to lead this effort by holding this hearing as well as many others. We couldn't agree more with the President on the bipartisan nature of this, and we want to thank you for taking a lead in all of this effort. We're beginning to see some good steps being taken. However, it takes all of us to continue to work to reverse this tide. Where I've learned the most is from Hoosiers back home on the ground, from moms and dads, brothers and sisters. My colleague, Congresswoman Susan Brooks, and I held a roundtable in Indiana to bring together health officials, doctors, and pharmacists to get as many perspectives out on the table as we could. What I've learned from those conversations is we have a lot of work to do, particularly in raising awareness on this growing public health crisis, enhancing prescriber best practices, expanding access to treatment, and increasing access to overdose reversal options like naloxone for emergency personnel. There's a lot of wisdom out there. We appreciate all you are bringing to us today. I want to thank our witnesses who came to testify, and I want to thank our chair for holding this incredibly important hearing.